I'm John Rennigan, the Lift and Capital Programme Manager for NHS Sheffield. LIFT stands for Local Improvement Finance Trust, which is a public-private partnership between the NHS and a private sector provider to build and maintain new healthcare facilities in Sheffield. Community First are the private partner for LIFT in Sheffield. The NHS is a shareholder in that company and therefore receives the benefits of being a shareholder, which can then be ploughed back into healthcare in the city. And Jordanthorpe is an excellent example of LIFT in action. It's delivering new state-of-the-art primary care facilities for the people of Sheffield.
2007 saw the grand opening of Jordanthorpe Health Centre. So we went along to see how the medical team and patients feel about the exciting new building.
I find it's great having everything so close. You don't have to travel miles for physio. The building's fantastic, but the staff as well, you know, that's improved greatly, you know.
You seem to get seen to quicker, you get appointments quicker, you can pre-book appointments. I know it's bigger practice, it's cleaner, it's better. I think it's just better for the estate.
The self-signing in procedure, you know, on the touch screen, much better. You're not waiting in a queue, you can just touch the screen, which takes seconds, and you sat down. Coming here, you do feel a little bit better, because it's brighter, it's cleaner, it's airy, and you get seen to more or less straight away.
With a lot more space, it's light and airy. We'd only got one phone for booking appointments and one phone line for booking appointments before, whereas we've got 6 lines coming into this building. It's a lot better.
My name's Dr. Penny Bradbury. I've worked at Jordanthorpe for over 20 years now, but of course the majority of that time was in the old building. We only moved to this lovely new building about 9 months ago, I think it was. The old building was built, I believe, about 1969 or 1970, when the rest of the estate was built at the same time. And it had outlived its planned shelf life, basically. The roof leaked, we used to have to skip around buckets of water in winter, the hot water and the central heating didn't work properly, the window frames were rotten, it was in a terrible state.
This is it. I'm not sure you really want to video this. This was the main entrance. Pretty grim.
It didn't look as grim, obviously, when it was in use, because we used to get the graffiti cleaned off as soon as it appeared. But we would go through runs of having to have the glaziers out every single day, because every single night another window would get smashed. It was a running battle. You can only maintain a building for so long, and I understand this one was only designed to be used for up to 20 years max, and we got nearly 40 years out of it. So this place, well, you can see the difference. I mean, even compared with the building that was sound, I think this place would be vastly different. So this is our physiotherapy gym, which is used obviously for physiotherapy sessions. This is the recovery bay for the patients who've undergone the podiatric surgery in the operating theatre, which is just to our left here. A great big meeting room here with projector facilities. We're just about to go into the area that is used by the dentists now.
We're just going into one of the new dental surgeries, so we can go and have a little look round if you like. So here we are. This is actually surgery 2. It's a brand new surgery. Everything that we've had done in here has come into standard with the new infection control guidelines that are out at the moment, which means we have these really nice cleanable surfaces called Corian and Corian sinks. As I say, all these now fit in with the new infection control guidelines. Dirty and clean utility are quite a unique part of this new setup that we've got here at Jordanthorpe. It enables us to have a decontamination technician who actually sterilises all the instruments for the team. We're now going through into the X-ray room. This is an OPT X-ray machine. This X-ray will take a full scan of the patient's mouth. and luckily now we can actually transmit that x-ray to both surgeries here and then hopefully on the wider city network to other surgeries within the salary dental service. The dental service used to be provided in a dental mobile which used to park in the car park of the old medical centre. It was a very old mobile. It was very difficult to access for patients, and now we've moved into the medical centre. Patients think the service is just wonderful and the facility is wonderful as well. It's warm, it's clean, it's pleasant, and not only the patients think it's wonderful but the staff think the facilities are great.